The Family First Coronavirus Response Act. So this is where it gets more complicated. Businesses that are covered are certain public employers and private employers with fewer than 500 employees. Those that are not covered are most federal employees, because expanded provisions for family and medical leave are still there, but they will be covered by paid sick leave. Small businesses with fewer than 50 employees may qualify for exemption. These are the necessary things for qualifying for leave for employees. Their federal, state, or local quarantine or isolation order related to COVID-19. A healthcare provider has advised them to self-quarantine related to COVID-19, or they are experiencing symptoms and are seeking a medical diagnosis. The pay for this would be their regular rate, applicable to minimum wage, whichever is higher, or up to $511 per diem and $5,110 in the aggregate during a 2-week period. And those that are caring for an individual subject to those orders stated above in 1 and 2, or those experiencing any substantial similar conditions specified by the Secretary of Health and Human Services in consultation with the Secretaries of Labor and Treasury, will receive 2/3 the regular rate of pay and 2/3 applicable minimum wage, whichever is higher, up to $200 per diem and $2,000 during a 2-week period. Those caring for their child who is not in school or their place of care is closed, or child care provider is unavailable for reasons related to COVID-19, full-time employees will have up to 12 weeks of leave, 40 hours a week. Part-time will leave up to the number of hours that they normally are scheduled to work during that period. 2/3 regular rate, or 2/3 the applicable minimum wage, whichever is higher, up to $200 per diem and $12,000 in the aggregate 12-week period. 2 weeks of paid leave and 10 weeks of paid extended family and medical leave.